Aloha. I'm Dr. Rhonda Black. I am a professor in the Department of Special Education at the University of Hawaii at Manoa, and I'm here with my colleague.
Hi, I'm Dr. Pia Francisco Natanawan. I'm an adolescent and young adult medicine specialist at Kapiolani Medical Center for Women and Children.
And today we are going to talk about listening to my body, the adolescent and the young adult.
After this talk, we are hoping for you to become familiar with the normal adolescent growth and development, and so also to understand the phases and tasks of adolescence. And finally, hopefully you'd understand the reproductive health of adolescents and young adults, and adolescents and young adults with disabilities. So what is adolescence? You can think of it as a transition stage between childhood and adulthood. You can think of it as that time frame that you can think of teenage years and when puberty is happening. It's typically a dynamic period of growth and development. It's when people are really growing fast. It's only second to infancy in terms of developmental changes, especially within the brain. When I talk about adolescence to my patients and the families, I think of the phases of adolescence so I can better understand it. It is important for you to have an idea of this too. You can think of them as the ages divided into 3 or 4. Early phase of adolescence is from age 10 to 13, roughly. Middle is 14 to 17. Late is 17 to 21. And young adulthood is 18 to 25. Note that there are overlaps in the ages because this isn't absolute. Early can also be even before 10. So why this matters is so that we can understand the thinking of an adolescent. I'll start talking about early adolescence. And again, typically 10 to 13 years old. So maybe think middle school years. The adolescent will undergo rapid pubertal changes in the body. Note that girls will have it earlier than boys. You can have it as early as age 8 for girls through 14. When the body's changing, a person will feel self-conscious about the body. And so it's very common to have body image concerns. In fact, more often than not, I would see patients with eating disorders start to have the symptoms at this age. When a person is going through early adolescence, they will possibly find that struggle to try to assert themselves more. It's that independence/dependence struggle because they would be more interested in talking to their peers, but then they would still have to be reliant on their parents. For example, they want to go to the mall, meet up with their friends. They would want their parents to bring them to the mall, but they don't want the parents to be with them when they're at the mall because they want to be identified with their friends. That emotional void, say like the parents wouldn't let them and they can't hang out with their friends. That can be a source of emotional void, and that can be a source of behavioral issues down the road. And I'm not talking about, just one time. If it's something repetitive as an experience for that early adolescent, then it can become an issue. They're very interested in same sex, meaning like they're hanging out with that group of same-sex friends. And as far as who they are or their identity, they can still be daydreaming a lot and maybe have like thinking about what they want to be when they grow up. It doesn't have to be something that is already set in stone, but they can think about these things. They also start to have abstract reasoning at this time. Middle adolescence can be marked by when a teenager has intense feelings and they actually value more of what their friends have to say or what social media has for them. You can see this, the age group is 14 to 16. And when you are coming from early adolescence, when they don't want their parents around, you will see this more in middle adolescence. They don't want to be talking to their parents. You can probably expect more conflict at home because if the parents aren't ready for their teens to be asserting themselves, then the parents would feel disrespected. And then the teen will prioritize their friends. And oftentimes that will be a source of argument at home. And those arguments can become very intense. This is also the time, aside from their friends are valued more, a teenager can be expected to be interested in going out romantically. Romantic partnership, and going out, and maybe extracurricular activities would be the center for this person's interests. They would be possibly more realistic at this time, but I think what stands out for me when I see a middle adolescent is the risk-taking behavior, because they just feel that they're immortal and they're omnipotent, like nothing wrong will happen to me. Maybe to other people, but not to me. That's your middle adolescent. A late adolescent, maybe 17 to 21 years old, they are, because puberty is maybe completed at this time, their identity would be established. They wouldn't feel as self-conscious about their bodies. They probably would be more creative and also have learned more from school. This is what, like senior year to starting college. They are more into what they would want to do for themselves. So they're not as, like, social media or maybe friends' input wouldn't be as important as their own. And they would have the ability to keep a serious romantic relationship or even serious friendships. They potentially can actually learn more or listen more to their parents at this time. The young adult is when they're like past 20s. It would be, you can think of it as maybe done with college or maybe working after high school. It's adulting. They are formulating their own decisions. They are gaining financial independence, and they're more responsible for their actions. End of adolescence, it's not really something that you can describe as an age. It's less well defined, as opposed to like when we think of the start of adolescence, because we have pubertal changes in the body that would mark the onset of it. We know we can call it as end of adolescence if you feel like, okay, my child is a young adult, is so independent. Maybe you can think of it in that way. What we've observed though is that adolescents tend to be longer in modern societies. And that's because of like the economic and educational factors, say like in Western societies, because you can do more schooling after college, you can have postgraduate and you can have other courses, then you may be still like within that adolescent age group, as opposed to say a person who would be in a developing country where you have to work, possibly have to work while you're in high school and right after high school. Then you have quote unquote adulted in that sense of being responsible. Then maybe you don't in thinking that's the end of your adolescence. This is a person who I think would, just the pictures, would depict like, okay, early, middle, late, and young adulthood. You can go on the pictures from left to right, top, left, then round robin, I suppose. But early, remember, what is important is their appearance. And so different hairstyle from the top left to the second to the left. Very sweet. And then middle adolescence, you can have risk-taking behaviors, you're omnipotent, your friends matter, social media matters, you're more experimental. You can note the piercings and the jewelry. And then possibly middle to late is when you can see like there are tattoos on this person. I actually don't know when the tattoos happen. I just thought it would help us remember like the phases of adolescence with these pictures. And then as you grow older, late adolescence, you have your own style. And then young adulthood, possibly, it's not that you don't care, but just like you are your own identity and you're independent. And that's adolescence in pictures. The tasks of adolescence, I want you to think about, okay, there are kind of like milestones you want to meet during this time. And these are important because when you have these tasks, then you have development, it's normal growth and development. So what are they? Part of it is expanding cognitive development. A person would be achieving independence and accepting one's body image. A person would be adopting to the lifestyle and the culture and what their peers have. They would establish themselves, the identity, their sexual identity, vocational identity, social and moral identities. If you put the phases of adolescence in a table, if you like tables, I think this table can be overwhelming, but it's a good snapshot of what we have talked about. The tasks on hand would be independence, cognitive development, body image, peers, and identity, and what you can expect for an individual to experience and to meet depending on the phase of adolescence. The thing about this is that if an adolescent doesn't, if the task isn't completed during the necessary phase of adolescence, it can be a source of pathology, meaning like that can be the source of the issue. The issue doesn't always mean it's a diagnosis, but if it's happening more frequently or more often, then potentially that can be a condition later on in life. Wait, there's more, right? It's not just adolescence. Puberty, again, well, it's the body changes that is happening during this time. What happens with puberty? You would have biological, cognitive, and behavioral maturation. There's increase in sex hormones. That's an autopilot mode of the body when it comes to puberty. The changes in the hormones, it's in every male or female individual. You have the changes for both male and female hormones. Estrogen, progesterone are the female hormones, and testosterone is the male hormone. There will definitely be changes in the brain. The cortical and subcortical gray matter and white matter brain, they mature. This actually takes the entire time of adolescence. We put the fourth slide here, fourth rectangle. This is why sleep is very important. Because in order for the maturation, the normal growth and development to take place, for hormones, for the body, for the brain, you need adequate rest. And I can't stress it also on this slide, but you also need nutrition and a well-balanced lifestyle. We put sleep is important because adolescents are quite known to be sleeping late. And when is it good, when is it bad? We would say the time is always good to have adequate sleep. What you want to remember with puberty are the secondary sexual characteristics and like the time-wise. I've mentioned earlier that girls would have pubertal signs start earlier than boys. So you can have it as early as 8 years old for girls. And the first sign there is breast budding. Boys, you can think of them happening 2 years later than girls. And the first sign for boys is testicular volume change, meaning the testicles get bigger. You don't see it because, they're dressed, they're clothed, but possibly, and the boys probably wouldn't notice either. But when you see your doctor at your annual doctor visits, the description would probably be like the scrotal sac, they're darker than before. The average length of completion for pubertal changes to happen, for girls, it's 4 years. For boys, it's shorter at 3 years. But the duration for each individual to undergo puberty can happen in the span of their 8 to 16 years old, and 10 to 15, excuse me, for girls, and then 10 to 15 years old for boys. The physical changes during puberty, and this is a repeat of what I've mentioned earlier. Puberty, during adolescence, it's a time of rapid growth and development physically and psychosocially. I think what I've added on this slide is that adolescents and young adults with disabilities and without will have the same important health priorities. Sexual health is a priority in adolescence, along with mental health and primary care. The adolescent brain development is a highly coordinated sequence of both cell and growth and pruning. The white matter volume increases. It corresponds with the drastic changes in physiological processes and body composition during puberty. So, this is a lot of words for this slide, right? So what basically would tell us in an adolescent brain is that it's highly dynamic and it's actively growing. When do we expect an individual to complete this brain development? It actually goes through young adulthood. I like to give this as an example for when I talk to our medical residents at UH Medical School. When is that age that car rental companies would change their rate? If you know the answer, it's age 25. Roughly, adolescent brain development is completed by that age, but for whatever reason, car rental companies have that figured out. I'm not quite sure. Because if you think about it, like, why is alcohol, the legal age for alcohol consumption is 21, and then 18, I think, for cigarette smoking. Those are still very young. The brain's still developing. So if they're using that in the brain, they're using substances and the brain is developing, the brain's not going to be developing well with substances. So I guess, fortunately for we have like, okay, I can use this analogy with car rental companies. So just try to remember, the brain is developing throughout adolescence and young adulthood. Maybe as a parent, give yourself that patience and working through with your adolescent and trying to understand where they're coming from. This slide is busy. I guess I wanted to give you a picture of what the executive human brain functions are. That would be, the part of the brain that would be responsible for this is the prefrontal cortex. The prefrontal cortex is not developed in your early, middle, late adolescent, and possibly in young adulthood is when it's going to be completed. It's that part of that brain that is actively developing. As you can see here, there's too many things that the prefrontal cortex would be responsible for. I think the biggest one here that you can agree with me is impulse control and delaying gratification. So it's not just, how maybe you'll hear about, oh, it's a millennial thing, or maybe it's a generational thing. For an adolescent, you have physiologic basis of why they're acting as such. And so try to remind yourself, your child's brain is developing. That's why they want easy gratification, and they're acting so much before actually trying to figure out things.
Well, we've talked about typical adolescent development, but we also know that some individuals have delayed development. One of the things to think of here is that most physical development for individuals with disabilities has taken place in these same stages and approximate ages. It may be the cognitive development that's delayed. So one may think that because cognitive development is delayed, that the same emotional and physical things aren't happening during puberty, but they are. Executive functioning may happen even later. So that modulation of intense emotions, being able to set a plan, see the consequences, and carry through may happen even later for someone with a cognitive delay. But one of the things I wanted to talk to you about is Piaget. Hopefully, maybe you've heard of him, but he had this stage theory that was very appropriate. There was the earlier stages, but in adolescence, the young person moves from concrete operational to formal. So what that means is at this concrete operational stage, logical reasoning can only be applied to objects that are real or can be seen. So that means whatever you are talking about to your adolescent, it needs to be kind of concrete. There needs to be like an example, something you can actually relate to. It isn't until a little later that you can start talking in hypotheticals. So about abstract ideas, being able to carry logic through to the end, like what are the consequences if you do this, being able to carry that logic thread through. So there may be times, if we take these years, if someone has a cognitive delay that's a few years behind, it may mean that there is a longer period of time where we need to present information in a concrete manner for it to be understood. So, at the same time that the adolescent is trying to assert their independence, at the same time there is puberty going on, there's also this give and take with being able to understand abstract concepts such as social justice, freedom, vulnerability. All of those things may be a little more difficult to understand. So like the idealist versus pragmatist. The other thing to remember is that these stages aren't just set. When one is entering a stage, they're still partially at the stage behind. So as an adolescent starts developing abstract thought, it depends on the context. They may go backwards and it's like they are very concrete and very set on one thing, but thinking about their future and what they're going to be in very abstract terms. So it's not just, yes, you're now in the abstract phase. It goes back and forth. And that is probably one of the primary characteristics of adolescence is the up and down. That up and down, that changeability. In addition to cognitive, we also have these stages of moral development. Erickson had these 8 stages of moral development, but what I wanted to focus on is just these 2 for adolescents. So as the adolescent is trying to differentiate from the family and develop their own identity, if they are not allowed to try on different identities, really explore identities, it can result in role confusion. So it is very important that there are opportunities for the adolescent to explore different identities, to explore what different people are like and what different people value so that they can start developing their own. The next one is intimacy versus isolation. So in later adolescence, this is when friendships deepen. This is also when romantic relationships might start forming. So being able to think of longer term commitments, being able to be comfortable with relationships, being comfortable with commitment, safety, and care. if we prevent these relationships from happening, it can result in isolation or in the young person not developing the skills needed to successfully have committed relationships in the future. So we want to explore and allow deepening friendships, deepening relationships to avoid isolation, loneliness, fearing of commitment, and fear of relationships. So this whole stage, the identity versus role confusion, just differentiating from the parents and becoming one's own independent self. Beginning to look at the future. Just what am I going to be? Who am I going to be? And begin to form their own identity based on the outcome of exploring. And the intimacy versus isolation, sharing ourselves more intimately with others, relationships that lead towards longer term commitment, and establishing care. This also comes within adolescence, moving more away from the egocentric a little bit, where it's all about me, to starting to think about others, which this is one of my all-time favorite psychologists, David Elkind. He happened to be a student of Piaget, but he studied just adolescence. And he said that adolescents are overly concerned with their own thoughts and feelings. So what we might see as drama. So, and we might say, just get over yourself. It is part of the development. They are very overly concerned with their own thoughts and feelings. They believe that others are watching them constantly. For example, I have a blemish. I have a zit. Everybody at school sees the zit. Everybody's talking about my zit. Everybody thinks that my zit is like super important. So there is this belief, and as you can see, it's still, it doesn't mean, egocentrism does not mean selfishness. It just means thinking from this point of view and not taking the perspective of another person's point of view. It doesn't mean selfishness. It just means where the thoughts are centered. So this imaginary audience can lead to a lot of drama. One thing we don't want to do is tell kids, oh, nobody's looking. Oh, don't even worry about it. Nobody's even paying attention, because in their minds, it is real. So your perception is different. Don't discount what they are thinking and feeling. The personal fable goes into what Pia talked about a little bit earlier, that adolescents believe that their experiences and feelings are unique. No one has ever felt this way before. No one has ever loved as much as I have. No one's ever been as humiliated as I am right now. But that is the reality at the time. And this illusion of invulnerability, that it won't happen to me. I can be reckless. I can engage in dangerous habits, whether that be with drugs, alcohol, online, sex, but it won't happen to me. That only happens to those people. You know, only bad girls get pregnant, and I'm not a bad girl, so it won't happen to me. This is all part of what they're going through in adolescence. So this is just a cartoon I found, you know, here getting their identity. Oh my gosh, there's somebody, they're looking at my face. Just so all of the kids are so into their own selves that they probably don't notice that blemish on someone's face because they're too worried about their own. I'm going to turn it back to my colleague, Pia.
So we're going to talk about sexual behavior of adolescent and young adults with disabilities. This is something that I talk to colleagues and medical students alike, because what we think actually that adolescents and young adults with disabilities, they are innocent and childlike, that they are socially isolated and possibly would have limited normal sexual experimentation and social development with a short lifespan. Nowadays, we know better. AYA with disabilities live longer and have successfully become adults. And so it's important actually in the medical community for us to talk about and address sexual behaviors of all AYA, disabilities or without disabilities. AYA with disabilities, we found that there is no difference with their sexual behavior compared to their peers in terms of when they started having sex, the age of sexual debut, pregnancy and pregnancy rates, contraception pattern use, and sexual orientation. In fact, those AYA with disabilities more likely to have been sexually abused because of the previous slide. We think they're childlike, we think they wouldn't experience as much, or maybe possibly parents and doctors are overly protective in terms of like how the sexual orientation and experience and activity of that individual would be. Sexual activity and high-risk behaviors in AYA with disabilities, they have a higher chance of this because potentially their self-esteem wouldn't be as good as one would expect for someone without disabilities. They may be experiencing decreased peer acceptance. Possibly so, there would be late maturity in boys more than the girls, although in general, AYA with disabilities, you would probably experience development later compared to their peers. And overall, the increase in life stress would contribute to how AYA with disabilities would be having high-risk behaviors or maybe have been abused. When it comes to their sexual health, it's very important for us as providers, and the message for the parents is that we ought to have special consideration for guiding our patients with unique needs and abilities. We know we've identified the barriers to reproductive health care. It's the clinicians or providers' limited experience. It possibly is the limited access of the patient to reproductive health care. And then also the caregiver's understanding of a child or AYA with disabilities. We ought to know that they have the same medical care needs in sexual health compared to their peers.
So there are some factors that increase vulnerability to abuse. One is for someone who may have a cognitive delay, also for someone with a communication disorder, there is a belief by the perpetrator that they'll never be found out because the victim either won't tell or won't be believed. And in addition, a lot of perpetrators are in a position of power over the individual, an older adult, whether that adult is a caregiver, a family member, etc. And so that person in power will tell the young person with a disability, don't tell, don't tell. So there's this acquiescence to someone in power over you, to that adult, to that person who you perceive as the more capable other. So that type of acquiescence can contribute to vulnerability to abuse. One of the ways to combat that is to allow children to say no, to talk to them about. You don't always have to go along with something the adult tells you. So just discussing it. There's another one. A lot of individuals with disabilities, especially cognitive delays, there is just an intense desire to be accepted. I will do anything to hang out with you. You are the popular kid in school, and look at me. You're interested in me. I want to do anything to belong. That, and then gullibility plus lack of experience. And lack of experience means a lot of times those talks with friends. A lot of individuals with cognitive delays haven't been at the sleepovers when they've been talking about dating, So for many of us, we learned the most about relationships from our friends, like, oh, he did not say that to you. Oh, you do. No, that is not right. I'm sorry. He doesn't call you. You don't go out with him. All that. A lot of individuals with disabilities have not had those same kind of peer relationships. So if we can increase access to peers, increase access to inclusion, so that there are more of these typical adolescent experiences and talks, we can decrease vulnerability. If the individual is not isolated, if they are not segregated and separated, the intense desire to be accepted will be lowered because they are accepted. They have a community of friends, they have a community of people around them, and so they are accepted. I do have one very quick story. There was a young girl who told me that there was a boy in her apartment building, and he was general ed, typically developing peer, and he asked her over because to hang out. When she got there, he started touching her, and she didn't really like it, but he said, that's what we do. That's what kids your age do. Don't you know that? So to belong, to be with a popular boy, to do all that, she went against what she was feeling inside, that she didn't feel it was right. So we need to prepare our young people that they can say no. And also make sure that they have other ways to be accepted and feel like they belong. Another thing that contributes to vulnerability is overprotection. And I found this picture, love it. The little kid all getting wrapped up in bubble wrap. Overprotection also means undereducation, and lack of education contributes to vulnerability to abuse. Yeah.
So the adolescent health care is important. Young men's and young women's health discussions can be approached at different times. Like if the doctor would be talking about it based on pubertal changes, then that would be an important time to make sure that you're seeing your doctor regularly. However, I think too that sometimes, because it's not so obvious in boys, that puberty changes are happening, you as a parent can actually start that discussion with your child's doctor to make sure that these things, sexual and reproductive health, can be addressed as early as possible. Because because of these things that we have talked about in the slides, we ought to remind ourselves and be more acclimated about, or more knowledgeable about how or when to expect things for our children with disabilities. It's important to know that the bodies will have normal growth and development, as do their peers. It may be expected at a later time compared to their peers, but the important points to talk about should remain. And you can talk about it, start talking about noticing pubertal changes and talking about healthy relationships at home. And then you can extend that discussion or have more questions with your doctor at the doctor visits.
And if you have a son or daughter with more significant disabilities, there are resources out there about how you may talk about puberty, how you can help your daughter with menstrual care, etc. There are resources. You just need to talk to your doctor.
Adolescent healthcare menstrual management is actually something you can really talk to your doctors about. I see this in clinic more often than I would hope for. No, I shouldn't say that. I should just say, I see this in clinic, period. I do talk a lot about pubertal changes for my adolescent population. I do see the times when they would need extra guidance on it. So what I'm trying to say is that if your child would need that discussion, you can talk to your doctor, you can talk to me about it in terms of menstrual management. So what we know now is that birth control is not just for birth control alone. It can be used very much so to manage a person's periods. For example, if your child with disability is having tantrums around the time of their periods, that could be from just plain, it's painful, mom or dad. We can use birth control for that. Or if a person is not so, if a person is thrown off with the sight of blood, as do with any other person possibly can or would happen, birth control can actually alleviate that person's fear of seeing blood. So oftentimes parents would be worried about giving birth control as like a go signal, you can have sex freely. No, it does not. Birth control has the non-contraceptive benefits. And for an AYA with disabilities, it could be for pain relief. It could be not having periods and actually giving them that reassurance that they're nothing wrong is happening with them when blood is happening from their reproductive system. On the other end of the spectrum, we ought to also think about that. Yes, possibly the AYA with disability may also have been having sex, and that it's important also to be thinking about STD screening and contraception for contraception per se. Some recommendations to parents of teens in general. Listen and show interest and concern to your teen, and you want to treat the comments seriously. You don't want to get into power struggles. You want to have that flexibility, and possibly when you have these discussions, you are spending time together more productively so. You want to demonstrate trust in your adolescent. And in case you wouldn't know, say you have a conversation and you don't know the answer right away, you have resources in our community. At the end of this talk, you will have the resources available to you. But it's also important that you ought to have those resources available to your adolescent. Like what Rhonda had said, it's important to talk about expectations. When you talk to your adolescent, you have to be clear about them. But it doesn't mean that you're being, just a strict parent. You have reasons and why you're setting the limits, setting rules, but you have to be clear. In that way, it's not, you're showing your adolescent that you are caring for them as every parent would and would like to do for their adolescent, but at the same time, you are there as a parent to have that guidance for your adolescent. You don't always have to overreact based on the limited information or minimize the things that they're talking about, but having that listening ear as a parent would help a whole lot with that relationship you're building with your adolescent.
So in conclusion, Adolescents and young adults with disabilities and peers have the same important health priorities when going through puberty and adolescence. Sexual health is a top health priority in all adolescents, along with mental health and primary care. We want to thank you. Here are the resources that we mentioned. They are available on the PowerPoint. And we just want to say thank you for your time. And there is a QR code to our presentation slides.
Thank you, Spin, for this opportunity. Thank you, Rhonda, and thank you for the audience for taking the time to watch this presentation.